So welcome to another 3 questions about the Pain Diaries. Our regular question number 1 is, who are you?
I'm Pam Barton. I'm a physician who specializes in physical medicine and rehabilitation.
Now that's interesting because I bet most people don't know what that means. Physical medicine and rehab.
So it's a specialty which deals with the medical care and rehabilitation of injuries of individuals after catastrophic injury or very severe illness such as MS, strokes,
Interesting.
spinal cord injury, that sort of thing.
So chronic pain is something you encounter all the time in your days.
Well, certainly I do here, yes.
Absolutely. So we're talking about the Pain Diaries. Did you see the Pain Diaries when it was a play?
I did. I saw it several times, in fact.
Oh, did you really? I actually didn't know that.
Yes,
That's awesome.
well, I saw it as you were developing it.
Oh, with our
And
workshop?
Yes,
Yep.
and then I saw it, I think, twice afterwards.
Oh, cool. Because I do have pictures of you from opening night, so I know you were there then.
Yes, I was.
And so with the Pain Diaries, with the movie, we are trying to actually teach, because one of the big things is we have a study on knowledge translation through narrative. So I'm curious, as a doctor, I imagine your training was very scientific based, very book and lecture kind of based, other than, once you started seeing patients. How do you feel about teaching through storytelling? Do you think there's sort of any validity to it?
Well, I think it's an excellent method. In fact, when I teach the medical students, I do a 1-hour lecture to second-year medical students.
Mm-hmm.
What can you teach in 1 hour about the management of chronic pain? So what I do is I take 2 of my more articulate patients. This year, actually, I had 3. And I interview them. And my whole goal, as I tell the students, is to vaccinate them against all the negative things they're going to see and experience with chronic pain patients in terms of how other healthcare providers treat these patients. So, there are physicians who won't carry triplicate prescription pads, and others who won't prescribe opioids, and others who think they're drug seekers in the emergency room. And so all I'm trying to do basically is an attitude adjustment to make them realize that these are real people who have real issues, and that if they say they have pain, they have pain. And we need to respect that and be a little empathetic about the whole thing.
That's really fascinating. I actually never knew that either, and I thought I knew everything about you from all the interviews and things. So do you think that, because I know at medical school they're starting to use actors as patients and things like that, do you think that narrative is going to become the most popular method of teaching, or do you think it's going to be a balance in still with the books, still with the...
Well, my guess is it's going to be one of several approaches.
Interesting.
And if you have gone to any of our national or provincial parks here in Canada, you may have experienced some of the interpretive theatre that many of the naturalists use. So it's very entertaining and very informative. And I think really this fits into a similar category. It is a form of interpretive theatre where people can experience, vicariously perhaps, what it is to have pain and the impact that it has on family and friends.
Interesting. That's fascinating. Thank you so much for your time.